vaccines in my life, and certainly you could say that my risk of exposure to anthrax is much less than my daily exposure to COVID. I think it's early to get too worked up about it, and I'm curious to see what the data looks like as it comes in. And I'm learning this stuff right along with you. But I promise you, when the vaccine, when the science points to the fact that we need a vaccine booster, I'm in line. I felt crappy for a day or so after I got my second vaccine, but thus far, knock wood, I am COVID free.
Yeah, I'm right there with you. A dicier topic about your profession and the people who work in medicine. Mayor of New York is in the middle of this fight, kind of in disbelief that there's such a high percentage of people working in healthcare who have not been vaccinated, and in a way they regard themselves as the same as other people living in states that are either liberal or conservative, red or blue, the way so much of life shakes out these days. Do you know that you work with unvaccinated folks at your hospital? Has it come up as an issue? And in your view, should hospitals be able to mandate, require, if you're going to work here and be involved with patient contact, we need you to get vaccinated?
Absolutely yes to kind of all of the things you said. A, yes, it's dicey. And B, yes, I know that I work alongside unvaccinated people. We're still having people who are getting infected in our hospital, occasionally now and in the community. And you have to remember, healthcare is us. If you look at the amount of people nationwide who work in healthcare, it is one of the biggest, if not the biggest employer nationwide, and it is a good microcosm of that. So, of course, you have the physicians and people who have been, kind of rigorously scientifically trained, but then you've got a lot of people that work in, in healthcare. They're around, they're critical to patient care, but they may not necessarily understand the immune system and some of the intricacies that go with that stuff. Do I think it should be mandated? Yeah, I do. I think if you touch patients, you're absolutely responsible to do everything you can to keep them safe. I get the flu vaccine every year. This is nothing like any flu I've ever seen, so I'm all for it.
Ladies and gentlemen, our guest tonight is a military veteran and reservist, an ER doctor, and come to find out, a pincushion in his spare time. Dr. Stephen Sample, always a pleasure. Thank you for always finding time to take our questions. Have a good weekend. Coming up for us, this pandemic is a big player.